Dion, and yes, it's still your special program In Your Face. Let's quickly move straight to the discussion of today. I have a team before me ready to beat malaria in the state of Osun, Nigeria. Ready to beat malaria in the state of Osun, Nigeria. And I'll be starting this morning with Dr. Bello Ibrahim. Why that team? Why the team?
Yeah, the team is part of the activities of the Global World Movement, the RBM Partnership to End Malaria. So they are looking forward to eliminating malaria from sub-Saharan Africa and from all endemic countries in the world.
Yeah, you talk about eliminating malaria, and sometimes it just beats my imagination that, or maybe you can correct me this morning. Okay, you said something about eliminating malaria from sub-Saharan Africa.
Yes.
Where in the world do we have the highest prevalence of malaria?
Yeah, quite unfortunate is Nigeria. Nigeria is house to the highest number of malaria cases in the world. We have a share of about 27%
of the total malaria.
Wow.
Damola, be careful. Well, so if Nigeria has the highest prevalence, why should the theme for the World Malaria Day come from abroad?
Well, this is a global movement, and Nigeria is part of that body.
Yeah.
So, like, I'm a member of the Strategic Communication Committee of the Rollback Malaria Program.
All right.
So, based in Geneva, and I'm part of this work aimed at defeating malaria in Nigeria.
So you're saying that though the organization is headquartered in Geneva, Switzerland, which of course I'm sure malaria is not one of those things they are having to deal with. So you're saying that, is this a top-down approach or a bottom-up approach? Are you saying this is from Nigeria for Nigeria or from Geneva for Nigeria?
This is from Nigeria, by Nigeria, for Nigeria. This program is aimed at defeating malaria in a household, in a community here in Ilife, in Osun State, and in Nigeria entirely. If we defeat malaria in Nigeria, this progress, this success will permeate to all other sub-Saharan African countries.
Dr. Mrs. Temitayo, let me quickly take you on this. What is the significance of World Malaria Day?
Oh, thank you. It's significant, and then, like Dr. Bello said, it's a global thing. Even though it's a black man's disease, it's a black man's infection, but we all also know that malaria can be exported. It can get to those countries, and because they are not immune, it's not endemic there.
Yeah.
They do not have immunity towards them. So when malaria gets exported to their country, they tend to develop the severe form of malaria.
Yeah, right.
And that is why it's not only here that we have to combat it, it has to be a global thing.
I have a question for Dr. Bello. He talked about defeating malaria. Can we truly eliminate malaria in our country?
It's 100% possible. It's real, it's not a myth. Because it's a process that has been achieved in some countries. Last year, Sri Lanka celebrated a country without malaria. Kazakhstan celebrated the elimination, the completely eradicated malaria from their country. Saudi Arabia has eliminated malaria. Dubai has eliminated malaria. Jordan has eliminated malaria. And so there are about 10 countries in the last 10 years that have defeated malaria completely. And we know Nigeria is the giant of Africa. If it is possible there, it is with the right set of people, with the right set of knowledge, with the resources that is necessary available. Yes, and the will of the people. We know that we can defeat malaria.
All right. Now, talking about malaria, what is this thing called malaria? What is malaria? Dr. Mrs. Temitayo.
Thank you. Malaria is an infection that is caused by bites from mosquito. And what happens is that there are parasites. We call them Plasmodium.
Plasmodium.
Yeah, the female Plasmodium is one that is actually involved in the transmission of malaria to people. And what happens is when they bite, they release the sporocytes. That is what develops in the human. It goes around the circle, develops in wherever the victim is, and then goes into the system. The liver is affected, the red blood cells is affected, and then it's also this development, we actually call it the asexual forms. And then on the long run, it forms the male and female gametocyte, which is taken again by mosquito, taking another blood meal, and then the circle continues like that on and on.
So, doctor, what are the symptoms that is peculiar to malaria? I specifically use the word peculiar to malaria. What are the symptoms? What are those things that makes me feel that maybe
It seems like malaria is knocking.
Yeah, anyone that has lived in this environment understands one word from cradle to grave, and that is fever. I have fever. The next is headache, body weakness, joint pain, sometimes nausea and vomiting, and the drive to work, to participate in normal routine daily activities just lost.
I would love you to tell our people in Yoruba language so that those people that don't understand what we are saying in English can, have a feel of the symptoms.
Yes. And tó ń ṣe àìsàn malaria, ohun kankan òun náà ni wọ́n sábà máa ń sọ púpọ̀ jù tí a dẹ̀ mọ̀. Kódà bẹ́ẹ̀ tí ò ka nǹkan kan wá sọ àìsàn ibà. Torí pé ara ń bẹ̀rẹ̀ sí ní máa gbóná, orí ń fọ́ mi, ara ń dùn mí, so gbogbo àwọn oríkèé ó ń ro mí, mi lè jẹun dáadáa, àbí ó ń ṣe mí bí ẹni tí mo fẹ́ bì, àbí ó ń bì, so báyìí bẹ́ẹ̀ àti pé ara ò gbé kankan láti ṣe àwọn iṣẹ́ léyìí tá a mọ̀ ń ṣe ní pé tá a mọ̀ téèyàn bá ti jí èèyàn á múra àwẹ̀ á tètè lọ bí iṣẹ́ but ara ò ní gbé kankan láti ṣiṣẹ́.
Now, doctor, I haven't said that because fever is, how do I know, or how do we ascertain that this particular fever has been caused by malaria?
This is exactly the issue that is bothering us now. The WHO recognize and they ascertain the power of laboratory test, and now there are simple form of it that can be done virtually everywhere, even right inside there with just the strip. One should be able to do the test. Blood should be tested and it will show whether the person has malaria or not.
So you are talking about the malaria test kit.
Yes, malaria test kit. We call it RDT.
RDT.
Yes, rapid diagnostic test kit.
Yeah.
It works perfectly. With one drop of blood, you can know whether the person has malaria or not.
But I've heard so many people complain about that kit that is not readily available.
The kit is available. And I think the kit is affordable. We need the right set of attitude.
Okay.
Why I'm saying that, if somebody developed malaria fever in the United States, they would never serve him anti-malaria drug, except the blood test showed malaria parasite.
Doctor, I quickly want to take a follow-up question to that. Dr. Mrs. Adewale, you would agree with me that some time ago, when women get pregnant, they need to always go to the hospital to do a pregnancy test. And with time came the pregnancy strip that you could just walk into the pharmacy and buy and then do the, with urine.
Easily.
Early morning, the first early morning urine, you can just use the pregnancy strip and you can be sure that the result you get there is. Now, why is it difficult for people to get the malaria test kit? Or is it otherwise? Or is it just in our mind that we keep assuming that we can't get the malaria test kit by ourselves to do the malaria test?
Thank you so much. Like Dr. Bello just said, the RET is readily accessible. It is available and it is at a low cost. Just like the pregnancy test is available, we also have this kit also available in our pharmacies. It's also available in our hospitals. So all we need to do is when you have symptoms suggestive of malaria, especially fever in our environment, we know that more or less a high percentage of fever is actually due to malaria. So anytime you have fever, you can quickly go to your pharmacy and check. It is most of the time it is.
Doctor, do I need a prescription sheet to get malaria test kit?
No, you don't.
Because I know that these days almost everybody's asking you, where's your prescription sheet? So I don't need a prescription sheet to get the malaria test kit. Is that what you're saying?
You don't need a prescription.
So we could walk into the pharmacy, get the the malaria test kit, and then do the test, and we'll be sure that the fever that the person is currently experiencing is caused by malaria.
Yes.
Now, can malaria cause death, Dr. Bello? Can malaria, as simple as, because like you said, I mean, anybody born in this part of the world, is malaria is what you have been experiencing. So can it cause death?
Yes. Malaria is a deadly disease, and it has caused death of more children, especially because the children have the amount of blood is not much in them, so malaria parasite can quickly destroy the blood cells, and it can lead to cause of death in children. The pregnant women are also, their immunity is not strong. It can cause death in them. In the non-immune adults, people coming from abroad, if they are not properly treated, if they are not promptly treated, they can die from malaria. In fact, Nigeria has the highest number of deaths from malaria than any other country in the world.
For children or adults?
Combined.
I can't believe that. Dr. Adewale, are you saying that adults don't develop resistance to malaria? Is that what you're saying? I mean, I've been having malaria almost all my life. Then I don't expect that this thing should be able to kill me. I think I should have been able to develop resistance. My immune system should be able to recognize that this thing, for how many years now? So, are you saying that Africans we can't develop resistance to malaria?
No, we can't develop resistance to malaria. Even though the severe form, like Dr. Bello said, it's commoner in children below 5 years and then in pregnant women, because their immunity is still developing, and for pregnant women, the state they are in, it's making their immune system to be reduced. So we have the severe forms in these two groups of people. But then, even in adults, if there's no the early diagnosis, prompt treatment, they can also have the severe forms. It can still lead to death.
That's interesting.
Okay, quickly, I just want you to summarize to the people what you have for the people. Apart from this live radio program, what else do you have for the people in celebrating the World Malaria Day?
Yes, tomorrow we are going to the villages, rural and remote community in Osun State. We're going to tell them how to prevent this disease, because prevention is better than cure. All the control tools. So we'll try to highlight to them what they can do to prevent malaria. We're also going to test as much as possible those who have symptoms related to malaria, and we're serving them with free drug. We have a lot of...
The test is free.
The test is free. The drug is also going to be free.
Wow,
that's also we're going to give them mosquito bed net.
Wow.
So, and we are doing that on Wednesday at the Department of Family Medicine, GOPD, at the Obafemi Awolowo University Teaching Hospital, the General Hospital here in Ile-Ife. We are also going to test. We are also going to treat. We are also going to distribute bed net free of charge as part of these activities, because we want to showcase what we should all team up to do.
Dr. Bello, nǹkan tẹ́ ń sọ fún wa láàárọ̀ yìí ni wípé àwọn èèyàn wa lè wá sí hospital lọ́la fún yín láti ṣe ìtọ́jú wọn lọ́fẹ̀ẹ́. Ṣé nǹkan tẹ́ ń sọ fáwọn ará lé nìyẹn?
Lọ́la ìgbèríko là ń lọ lọ́la.
Ìgbèríko lè ń lọ lọ́la.
Ṣùgbọ́n lọ́túnla ọjọ́ Wednesday ní Teaching Hospital ní Ile-Ife, níbí General Hospital ní Ile-Ife, a máa ṣe àyẹ̀wò fún gbogbo àwọn tán bá wá. àyẹ̀wò àìsàn ibà lọ́fẹ̀ẹ́ la máa ṣe fún wọn.
ẹ̀dẹ̀ tún ẹ máa ṣètọ́jú wọn náà lọ́sùn.
bẹ́ẹ̀ ni gbogbo àwọn tí àyẹ̀wò yẹn bá gbé pé wọ́n ní àìsàn ibà wọ́n á gba oògùn ibà wọ́n á gbà lọ́fẹ̀ẹ́.
lọ́fẹ̀ẹ́.
wọ́n á gbà lọ́fẹ̀ẹ́.
ṣé ẹ lè sọ fún wa abúlé ibi tẹ́ ń lọ lọ́la torí àwọn ará abúlé yẹn náà lè máa gbọ́ rédíò lọ́wọ́lọ́wọ́ báyìí ẹ dárúkọ kán lè máa múra sílẹ̀ fún yín torí wọ́n mọ̀ pé ń bọ̀.
Yékẹ́mi, Akérédolú, àwọn ibi tí a máa dé ní.
ẹ máa dé Yékẹ́mi lọ́la ẹ máa dá Akérédolú lọ́la ẹ̀yin ará Yékẹ́mi àti ará Akérédolú ẹ máa retí àwọn dókítà lọ́la láti wá fún yín ní ìtọ́jú tó ní ṣe pẹ̀lú àìsàn ibà lọ́fẹ̀ẹ́ ni o.
All right, we're going for a short break. Please do stay with us. 930135, or you can call the alternate 9070 57347549 07057347549. Please do contribute to the program.
Dr. Bello, I want to ask a quick question. If I decide to join this, rollback malaria campaign as an individual, I mean, I'm not a doctor, I'm not a nurse, I don't work in the hospital, but I'm interested because you mentioned the name of countries where they eradicated malaria. If I want to join, what do I do? Okay, we have a phone call. Yeah. Hello, good morning.
Hello, good morning, well done.
Yes.
My name is Paul from United.
Mr. Paul, good morning. How are you this morning?
I'm cool.
All right.
I appreciate your doctors there.
Yeah.
So I have some questions for them.
All right, go on quickly.
One, the topic is eradicating malaria.
Yes.
And since they have resourced so far this morning, really discuss the prevention and treatment of malaria. What can we eradicate malaria by prevention and treatment? And the countries they mentioned, the 10 countries they mentioned, what measures did they take? Are they following suit? Now, the second question is this. What is the relationship between blood genotype and this malaria thing? See, when we were in secondary school, we thought that those in those with Delta lady, are more prone to malaria. Those with AS are, more tolerant. And what relationship?
All right, thank you very much for those questions, Mr. Paul. We really appreciate you.
Lovely questions.
Dr. Bello.
Yes. Eradicating malaria requires an integrated approach. It's just not one method, but conglomeration of methods put together. You know, when you have a reservoir, which is human being, if you are having the malaria in the body, the person is a reservoir. The mosquito bites at night, and then it bites me that has malaria and gives it to all my children because the mosquito bites all my children. Now, but if I cleared all those who have the reservoir, then even when the mosquito bite, will not be able to pick malaria parasite. So that is one. Then the second aspect is the vector control. That is, let us find a way of eliminating the mosquitoes, because it means that, like the good work that is happening in Osun State, this state government has embarked on one of the projects that is making the drainage facility. That is what you and me is expected. So we need to be involved in ensuring very good drainage around our houses. You know, in our small local community, we need to team up together to ensure this. So, and then how we need
good morning.
We need to get our message.
Hello, we have a caller. Hello, good morning.
Good morning.
Yes, what's your name and where are you calling from, please?
Ojo is calling from Ishe.
Mr. Ojo, can you quickly go on with your comment, please?
Let's start with the point. We are talking about patients that usually go to the pharmacy to get RDT. Is it advisable for the patient also to go and get drugs after doing the test?
Okay, all right, we have that.
Maybe he's talking about self-medication.
No, he's talking about the fact that after you've done the test, you bought the kit yourself. You did the test, and the test is saying yes, malaria positive. Would you advise that person to go ahead and also buy the anti-malaria drug?
Well, that also will be answered. But in furtherance of what we have discussed before regarding countries who have eliminated malaria, they use a conglomeration of factors, treatment, wide use of insecticide treated bed net, at least covering as much as 80% of children under 5 should be sleeping under the net. All pregnant women should be sleeping under the net. Apart from that, you know, malaria eradication requires enormous funding, and that is the seat that is our government needs to cover so much money. Now that is the problem we have in Nigeria presently, to convince our government to fund malaria eradication campaign. Widespread spray with what we call indoor residuals.
Dr. Bello, can I quickly take you up there? But I want you to answer the question of that last caller that says that after you have used the did you call it RDT? Yeah, after you've used the RDT and the person is positive, what should that person do?
Yeah, we encourage those who have malaria symptoms to visit their local clinic close to them.
Okay.
What we call primary care centers. Yes. So at this primary care center, there's a program by Global Fund along with Nigerian government. And that's supposed to ensure that RDT is available. So I don't know what the situation is, but they can really, those who have malaria should please walk to the nearest clinic. They will be able to do the test for them within 10-15 minutes, get the result, and give them the appropriate drug. We do not encourage self-medication.
Yes, and then just to add to that, the fact that you tested yourself and it's positive, I also want to add here that the fact that you had fever, it might be malaria, and then you've tested it's positive, there are some other things that can also be associated. And so I think you need a thorough investigation too. Let your doctor see you. Your primary care physician is very important here. You might have malaria with some other things, maybe upper respiratory tract infection and some other things. So it is good so that you can have a holistic care. Still visit your primary care physician.
So the idea of actually doing the test yourself to confirm. Hello, good morning. Hello. Yes. All right, Mr. Adewoye, good morning. How are you this morning? Yes. All right, go on quickly, sir. The question is that you know we were used to chloroquine treatment before, you know, for malaria, and now that you know we have new protocol, new forms of treatment, you know, and all that. That what is your advice for those that goes to quack for treatment and you know that still maintains the old treatment or the old protocol? What is your advice to such people?
Well, my advice to them is it's better to go to qualified medical personnel for treatment. In the case of chloroquine, resistance developed because of people use it, maybe they did not complete the dosage, maybe because of the beta taste and some other things, they did not complete it. And we have also found that monotherapy is also responsible for resistance. And when you're using a particular drug for a long time, the parasite gets used to it. And then it's no longer working, and that's why now we've introduced what we call combination based. That's why artemether and maybe lumefantrine and some artemether and then fansida and things like that. And so you have two medications in one to treat malaria, and so it is pretty difficult, at least for the malaria, to be able to get used to the two anti-malarials in that same medication. So we discourage monotherapy in management of malaria.
Yeah. So that's in addition to what Dr. Mrs. Adewoye has said. The malaria parasite, Plasmodium, is a stubborn organism. You know, it has the capacity to resist, you know, frequently used medicine. It's like putting a frog inside hot water, you expect the frog to die. But imagine the frog dancing inside hot water. That means it has been able to build a kind of resistance to it. That's exactly what this parasite does. And so we do not want anti-malaria to be abused. Use it only when you genuinely have malaria. So the WHO coined the word test, treat, and track.
Test,
Treat and track.
and track.
Yes.
There's still a question that you've not yet answered. The question from Mr. Paul. Now, what's the relationship between genotype and malaria parasite?
Yes, we observe that individuals who have a variance of sickle cell in their blood, we call it sickle cell trait, that is AS. So they a kind of builds much, they are much more resistant. They can withstand malaria parasite better than those who have the blood, the genotype AA. So if you have AA, you probably will have a more frequent malaria.
And just to add to that, patient with sickle cell, either the AS or sickle cell disease itself, what happens is that the red blood cell is not able to live the normal span. And so the normal time that is also necessary for the parasite to develop in those patients is also not completed because they continuously hemolyze. The red blood cells is not stable enough to allow the parasite to live enough in them. That's why it seems as if they build a little bit of immunity against it. But at the same time, if they have the severe malaria, it could be fatal in them.
Well, it's quite sad that we don't have much time right here in the studio. But I would love our doctors to just give their closing remarks on the program this morning.
Yeah, sincerely, as malaria is a big problem in Ile-Ife, in Osun State, and in Nigeria. Since we're using this opportunity to call on the state government to put in more fund into malaria control in all the local governments, in all the localities. Sincerely, we want them to heavily fund malaria so that we can defeat malaria. We're also using this opportunity to call on the federal government, sincerely, to take another look, not just this treatment of a kind of a thing that they are doing. We want a knowledge-guided approach, every funding, sincerely, well-coordinated effort, so that Nigeria can join the country list of countries that will be marking success of defeat against malaria.
All right, Dr. and Mrs. Tayo.
I want to thank you for listening. I just want to say that in our own little way, we can contribute positively towards eradicating malaria. Let's make sure our environment is clean. Let's make sure we use ITN, that's the insecticide treated net. If we're given, we had some people use it to catch fish, some people use it to do some other things. Please let us use it for what it is needed for. And when we develop symptoms, please let us present early in order to prevent the severe form of malaria.